would tell you one of the biggest things about a good vaccine program, and this is real important, is I don't have to see these diseases. The horses are healthy. I get asked all the time about this disease and that disease, and I just don't see it because I insist on my clients vaccinating their horses. The contribution of a good vaccine program is basically keeping the horse healthy, but also we're preconditioning these horses to fight off diseases that they're going to see at the track or at the show barn or at wherever they're at.
In running this operation, we run it pretty much like a military zone. We do the same with our health care for our horses. We use the best of everything. The best hay, the best feed, the best blacksmith, the best veterinarian, and we rely on them to pick the best stuff for us. And them choosing Boehringer makes us happy. My name's Eddie Woods. I own the Eddie Woods Training Center in Ocala, Florida. Over the years, we've had a lot of really nice horses here. I think we've had 6 Eclipse champions. The best horse we probably had here was Authentic, won the Derby. He also won the Breeders' Cup Classic. He went on to be Horse of the Year. In years gone by, we had Big Brown. He won the Derby and the Preakness, and was champion 3-year-old. We've been fortunate. We've had a lot of really nice horses come through here. As part of taking care of our horses, we need a veterinarian. We've used the same veterinarian since we went in business 30 years ago. Dr. Bill Russell, he's out of Peterson and Smith.
At our practice, we see everything from a companion animal that's been with somebody their entire life, to production animals, to race horses, to sales horses, foals, broodmares, stallions, but we treat everybody's horse the same. The most important horse, I tell everybody, is the one standing right in front of me.
We train about 250, 260 for the year. It's a rolling population. We'll have about 220 here at the same time. They come from all over the world. Some of them come from closed herds. And next thing, they come in here and there's a bunch of horses that have come from sales from other countries and everything. And it's kind of like sending your kid to school. He's going to get sick. And hence we stay on our vaccination program diligently to avert as much of that as possible.
If you think about how this farm is built, it basically brings horses in from all over the world, literally, and they have to be put together just like kindergartners are. And since they have a job to do and they can't miss days of work, and we like to keep them nice and healthy, they go on a very strict vaccine protocol. My general vaccine protocol is I'll use Viterra Gold January and July, and I use Calvenza Flu Rhino in April and October. Then we give strep twice a year. Rabies is client-driven or horse population-driven. You're preconditioning the immune system just like these people are preconditioning their muscles. We're trying to do everything possible to when they go off to make a living, that they're covered immunologically, that they're in the best health, they're the soundest, because they have a job to do.
I would dread the thoughts of us having a breakout of anything, hence we're on the vaccine so diligently. We're very fortunate. We've had nothing that's big time. No strangles, no encephalitis, no West Nile. The only way to keep your horse healthy is big time attention to detail. You can't lapse in anything, and in your vaccines or anything like that. They got to be done on a certain date, inside certain timelines. In relation to maintaining your herd's health, the cost of vaccines and what have you is just a drop in the ocean compared to what it's going to cost you to put everything right when it goes wrong. And we can't afford any little thing to go wrong. Fix it is a couple of nights in a clinic, forget it. And then the other things that come in, encephalitis and all the other nasty stuff, they can put you out of business. It's not even worth thinking about. So the cost of the vaccine is nothing.